In providing clarity on the modus operandi of the Pan American Health Organization in releasing its findings of the presence of the Brazilian P1 variant in Guyana, Dr. William Adukrow keenly highlighted that it is customary for the agency to work with governments to ascertain the facts before such disclosures are made.
Normally, if for PAHO to make a statement like that, normally it will have to have been done with government, with the country. Because PAHO doesn't have the authority, we normally don't have the authority to go and do a study without government approval.
Dr. Adukrow, who served as the Pan American Health Organization World Health Organization country representative for Guyana during the last 6.5 years, retired in August of last year. While he could not provide the specifics about the pronouncement made by PAHO's advisor on emergent viral diseases, Dr. Jair Mendes Rico, about the discovery of the highly transmissible variant in Guyana 2 weeks ago, he hinted that it is likely that a study was first conducted using local patient samples.
10, 20, 30, or 50. And let's go and test and see whether there are any variants. And once that is done, then we inform government that this is what has been, this is the situation. And then after that, we can then go out and publicize. Samples were taken to CAFA with PAHO. And that the analysis of which showed that we have one of the variant strains from Brazil.
Health Minister Dr. Frank Anthony has repeatedly denied having knowledge about the existence of the variant. For the last 2 weeks since the announcement was made by PAHO, the Health Minister continues to tout that he is awaiting a report from PAHO to confirm their findings. However, Dr. Adukrow made it clear that in conducting such studies in countries, the health authorities of the specific countries are usually engaged in the process, which includes the collection of patient samples. The health minister is still contending that the 10 local patient samples which were sent to the Caribbean Public Health Agency in January of this year to be tested for variants returned negative. Since then, no additional samples were sent. Several other health professionals, including Head of Medical Services Dr. Mahindra Karpan, have not ruled out the possibility of the variant in Guyana. However, they have detailed that the only way of verifying such is for more samples to be sent abroad for testing. Dr. Adukrow opined that it is critical for the relevant authorities to work together to once and for all ascertain whether the variant is here.
I think what is needed is probably for PAHO and government and CAFA to come together and say, let us study our populations and see what variants we have and see what we can do extra to prevent other variants from coming in, or we can do extra to manage these variants.
The P1 variant wreaked havoc in Brazil, overwhelming healthcare systems and pushing them to a brink. This highly transmissible mutation of the virus is said to be aggressive towards younger persons without underlying conditions. It has so far been detected in Trinidad and Tobago. Temika Rodney reporting for the HGP Nightly News.